guys, welcome back to my channel. I am Mika Zaniel and I am back with another video. In this video I'm going to talk about a topic that I keep seeing and reading about online, and I was asked this question about 2 weeks ago. And the topic is if you should become an OT or an OTA. So this video will be short because it's really based on one's preference. So hopefully by the end of this video you will kind of have an idea which way you want to go. But like I said, it's based on preference. If this is something that interests you, please be sure to continue to watch this video and like the video. Give me a thumbs up. Be sure to comment below. Let me go ahead and jump into this video. A little background: I have my bachelor's degree in a different field. It is rehabilitation services. And I have my associate's degree in occupational therapy assistant. So I will say, when I first started the OTA program, in the back of my mind, I was like, I probably should have just went for my master's in OT. But after working in this field as a coder, I'm satisfied with the decision that I made to become a coder instead of an OT. So when I made the decision to work in the medical field in general, it was always because I like patient care, I like patient interaction. That was my go-to when working in the clinical setting. So I will say, so one of the differences between OT and OTA: if you become an OT, you do get that patient therapist interaction still, but it is a little bit less than as a OTA. As an OT, they do a lot of paperwork. They have discharges as well as research. When it comes to paperwork for OTA, the only paperwork that we have is documentation. I know some facilities that ask if we do progress note. It depends on your facility, the company that you work for. The company that I work for, we started doing assistant progress notes, and then I don't know what happened, like a month ago they said we don't have to do it. So again, it depends on the company that you work for. But most companies that I work for as an assistant, I have not had to do a progress note besides the company that I work for now. As an OT, they're still required to do the research, discharge, and the evals. I have seen days where OTs would be like, oh, I have 6 treatments, but I also have 5 hours of paperwork. Whereas an OTA, we'll just come in, see our patients, and do our documentations, and we're done for it. You want to focus on just patient therapist interaction, treatment sessions, do your documentation, and then you're done for the day? Or do you want to do patient therapist plus a lot of paperwork? Another difference is pay. OTs do get paid a little bit more than OTAs, but there are instances where OTAs can make the same amount, if not more, than an OT, which is based on years of experience. And then also, like I mentioned before, you can work PRN. When you work PRN, you get paid more per hour because you don't get the benefits, and it's an as-needed position. But if you work a lot of PRN hours or jobs, you can make the same amount when an OT is making working full-time. I have heard of OTAs and PTAs making up to $80,000 a year. It can happen. I hope it happens for me really soon. But yeah, it can happen. Also keep in mind, when it comes to finances, is the cost for school. It is cheaper for the OTA program. It is associate's degree level, only 2 years, and for a OT, it is 2 years for a master, which costs more money. Some OTs complain about the cost that they pay. The cost for their master's degree does not equal out to what they're making as an OT. And when I say that, I mean they're saying that they're making a lot less as an OT compared to what they paid for their degree. For a OTA, from my experience, when it comes to schooling, like I said, it's a lot less. I would say my program, it wasn't much. So I think what I make an hour, it balanced out with what I paid for school. But I do have other student loans from my bachelor's degree, so you have to keep that in mind. Also keep in mind the state of therapy, and not just therapy, healthcare overall. COVID has done a number on healthcare overall when it comes to jobs. and then also Medicare cuts and reimbursements that had went into effect within the last 2 years, and a more recent one went into effect this year of January. So the job market right now for therapy overall is very how can I describe it? Can't think of the word that I'm looking for, but basically is if someone calls you for a job and you need the job, you probably want to take it because there's a lot of people there are looking for a job. So for me, that's the main difference. Like I said, somebody asked me 2 weeks ago, why not just do OT? I don't want to do with the paperwork. I like just going to work, seeing my patients, giving my treatment, doing my treatment sessions, doing my documentation, and going home. If I can make a good amount of money and doing less work, I'm gonna go with the less work, good amount of money versus more work and good amount of money. No. Far as promotions, I would say they're about the same far as OT and OTA. An OTA can become a director of rehab as well as an OT. I have been to jobs where a OTA was the rehab director and the OT was working under the rehab director, so it can happen. But I would say as far as higher positions other than becoming a rehab director or working in the school system as an educator, I would say that's where the disappointment for me come in as OT overall. There's not much level of growth in this profession. I'm hoping through the years that people would take a look into the field of OT when it comes to other positions that OTs and OTAs can qualify for. When I say that, I mean like becoming like a coordinator or an administration position in a hospital or any other healthcare setting. When I look for those positions, they're mostly for nurses or social workers. I hope over the years that those positions will start looking at OTs and PTs. But again, like I said, it's all on preference. Do you want to do a lot of paperwork and make good money, or do you want to do just patient care and make good money? Like I said, I don't regret becoming an OTA versus becoming an OT. I can make as much money as an OT working PRN. So yeah, that's pretty much all for this video. It's all on the preference. What works for you? What area do you see yourself working in? If you have any questions, please be sure to comment below, and I will see you guys for another video. Take care.